So going into this, we were very concerned about our trainees. We have a paternalistic role to play here with the trainees, and that is they're under our care when they're here. We want to make sure they're safe. One thing that I think we all learned is about our fear tolerance. And I think everybody's tolerance was a little different. I think people that were on the front lines were probably most fearful of getting infected with COVID. And it required us to spend a lot of time talking to people to understand those fears and then really protecting them. The juice really came out of necessity. We were unable to get any type of cleaning supplies in the early stages of the pandemic. So we knew that Purell, the hand sanitizer, was 70% ethanol. So that's what we made in the laboratory. We used grain alcohol and distilled water and made our own 70% ethanol. And using that ethanol for cleaning made the residents and fellows feel like we were doing as much as we could to protect them. Several residents came forward to tell me that they were fearful of taking care of patients because of the risk of COVID. After we've gone through the worst of this, some of those same residents have come back to tell me how important this experience was in their lives, how formative the experience was for their career. One of the most important aspects of our response was the response of the entire medical school. So in the intensive care units where we needed critical care faculty in particular, we just didn't have enough in the Department of Medicine. So we worked with the Department of Surgery, Department of Anesthesia, and the Department of Pediatrics. All of the departments have critical care specialists. So had we not mobilized the entire department, had we not had people work outside their comfort zone, the response that we had at the hospital would not have been possible. One thing that was important was to have a gathering place for our residents and fellows, particularly at noon. So we brought in food, we had open dialogue, and it made it feel like a homey environment. It was a place to land after all the hectic activity on the wards, and they were quite appreciative of that. I knew that we had several strong leaders in the Department of Medicine, and in fact those people were very strong leaders. But there were other leaders that I didn't know about that developed during the response, meaning that those people really stepped up and did what was needed. That was both gratifying and for our department, probably the single greatest thing that happened, that we have now this large group of leaders that are really feeling empowered now to take care of patients. I am so proud of how our department took care of these patients during the pandemic. And I think that our relationship with the hospital has changed to the better because of it.